EOFELUS.
Oh, there he comes.
Yeah, all right. Oh, he's here. Yeah, contact him. Morning, doctor. Welcome. Thank you for joining us. Okay. Yes. Okay.
We were starting to get worried.
Hello, hello. Do you hear me? Do you hear me? Do you hear me? Do you hear me? I will keep talking. Told to keep talking.
Yes, we're ready. Good morning, fellow citizens of Namibia. Welcome to the Covid19 Communications Centre daily update at 10 o'clock in the morning. My name is Emma Phyllis, the Deputy Minister of ICT, and I'm here to moderate the discussion as we discuss two things. One, the issue of the extension of our lockdown as announced by His Excellency Dr. Hage Geingob, as he did yesterday at State House to the 4th of May, but also a discussion around the alleged mistreatment and testing of African nationals in China. And to help me delve into those two topics, I'm joined by the Deputy Prime Minister, Honorable Netumbo Nandi-Ndaitwah, and also the Minister of International Relations and Cooperation. Thank you very much, Honorable, and thank you for joining us. I'm also joined by the Minister of Health and Social Services, Dr. Kalumbi Shangula, who will also specifically talk about what necessitated, from a health perspective, the extended lockdown to the rest of Namibia and to the 4th of May. Perhaps I can start with you, Doctor, especially since this is the discussion of the day around the extension of the lockdown. Yesterday you did mention through a statement around some of the health issues that necessitated this lockdown. Perhaps you could just delve a little bit deeper into why we extended till the 4th of May and why we extended it to the whole country and not just kept it to the two regions that were initially on lockdown.
Thank you very much, Deputy Prime Minister and Minister of International Relations and Cooperations. Good morning, ladies and gentlemen. It is now 3.5 months since COVID-19 was reported in China to the World Health Organization. It is also 1 month since the first case of COVID-19 was recorded in Namibia. The total number of confirmed COVID cases in Namibia remains 16, 10 days after the last case was recorded. Amid ever-increasing number of new cases in the world, the stagnating figure of 16 in Namibia attracts great interest. Namibia has been under the state of emergency for a month now. The lockdown, which applied to Erongo and Khomas, has now been extended to the whole country as from midnight, the 17th of April, 2020. The announcement yesterday of the extension of the lockdown by His Excellency Dr. Hage Geingob represent a significant development in our national response to COVID-19 pandemic. The extensions affords the remaining 12 regions to benefit from the lockdown process, and also the two regions which has been under lockdown, that's Erongo and Khomas, to consolidate the gains of the lockdown. A number of lessons were learned from the implementation of our response measures. The success we have scored thus far is the result of a central leadership provided by the President and a single command structure. Public awareness was very key, and I must commend the establishment of this communication center by the Ministry of Information and Communication Technology, in which the media played a critical role. It was pleasant to see messages coming out of the media houses united in a single cause. Please continue to do the good work and the good job for Namibia. The role played by the health workers was crucial. All the teams, without exceptions, coming from the case management to tracers, logistics and others, did a splendid job. The public and private sectors were united in fighting the common enemy. We can really be proud Namibians. The job is not yet done. Let us have no illusion that there will be no more cases. The worst may still come. The recipe for this to happen is already there. The purpose of a continuous lockdown is to suppress transmission by reducing the possibility of asymptomatic people with COVID-19 from further infecting others in the community. Whilst a lockdown inevitably limits people's right to freedom of movement, such limitation is justified to protect public health. The goal is to ensure that each confirmed case infects less than one person on the average. It is proven that this level of transmission interrupts the growth of epidemic, commonly referred to as flattening the curve. Our strategy going forward is to increase our monitoring and surveillance. As I have indicated earlier, we have revised our testing strategy to assess the degree of community transmission. As we all know, initially, we did not have the capacity to test locally. This has now been done. But the capacity was not enough to do all the tests we wanted done due to limited quantities of reagents. As we increase our testing capacity, we continue to revise our criteria for testing. We are going to test as many people as our capacity can allow. In doing so, we are guided by the epidemiological nature of the infection. We are going to do a targeted testing, going where we are reasonably confident of finding the target. What we are all going to do going forward is to comply with measures put in place. COVID-19 is not going around looking for people. It is people themselves who are the one going around looking for COVID, even if they don't know that they are doing so. The solution to defeat COVID-19 is simple: stay at home. Thank you.
Thank you very much, Dr. Shangula, for that. I think the message is very clear that necessitated this extension of our lockdown. Honorable Deputy Prime Minister, moving now from our national situation to an international one, concerns around Africans being mistreated in China, as well as being subjected to alleged forceful testing. We understand Mirko has issued a statement. Perhaps you could just summarize it a little bit for the media houses that are here and the public at large, what the position of government is, but also what the situation is on the ground.
Thank you very much. First, as an introduction, I would like to make it very clear that the Namibian government has never and will never condone any discrimination of any form and from any quarter, leave alone discrimination based on one's skin color. Many of us in this country have suffered racial discrimination, and we know its hardship. We do not only condemn it, but we challenge it. That's why we fought for our independence. To come to the specific question as to what had happened in Windhoek city in China, where it has been reported in the social media that there has been mistreatment and abuse of Africans in that region, which was perpetuated by officials and local law enforcement agencies in that city, who were given the responsibility to administrate the COVID-19 control and preventive measures, such as to control the behavior of the people and to ensure the testing. Maybe you have also followed that it was on the 19th March when the Chinese authority reported no case of coronavirus was detected in Hubei province. However, of late, they have recorded some imported cases in Wuhan city, thus decided to do testing of all the citizens. However, leave it as it might be, it could not be done in a manner that it had happened, that some Africans were mistreated, and African ambassadors had followed up with the matter with the authority. And a day before yesterday, that was on the 13th, there was a meeting between the African ambassadors and the Chinese Assistant Minister of Foreign Affairs, where the African ambassadors, including our own ambassadors, expressed our disappointment as well as our unacceptance on the manner the issue was handled. In return, the Chinese authority, through the Assistant Minister, they expressed their displeasure and not accepting how the Africans were treated. As a result, the central government has intervened and directed the officials in Windhoek city to be very sensitive and not to practice discrimination when dealing with foreigners, especially this time when we are dealing with the COVID-19. And as things stand now, everything is back to normality, and those who are to be tested, they are to be tested. Those to be on quarantine have to be put on quarantine. Namibians, we had 5 our citizens who were also tested during this period. 4 of them are students. 3 are living in campus, and we are informed by our embassy in China that that particular campus, during the time of restrictions, it was so relaxed to the extent that students in that campus now have to be tested. And currently, they are also put on quarantine for 14 days. The other student was renting a flat and he was moving freely, and therefore during this time he's also tested and currently put on quarantine in a hotel. As for an individual Namibian who is on a business mission, she was also tested and currently on quarantine in a hotel for 14 days, which is full paid by the government of China until her 14 days expire. It's true, as it's also reported in the social media, that prior to that intervention by the African ambassadors, there was an idea whereby African ambassadors came together and prepared their position paper, which they were going to present to the government of China. Unfortunately, it was leaked to the social media, and hence many of you have read about it. However, after meeting the assistant minister, they understood each other and they presented the case which they have presented to the minister. Here, back at home, in my capacity as Minister of International Relations, I also called in the ambassador of China, expressed our dismay on the manner how Africans were treated. As it happened in his home country, the ambassador also explained to us that it was an unfortunate situation and it's not the policy of China to discriminate against anybody, leave alone the Africans. Therefore, as things stand now, we can see the issue is resolved and the Africans in Guangzhou City, they are continuing with their normal life. It is our hope that such incidents will not occur. Similarly, we are still, as a country, asking our citizens that whenever they are traveling outside the country, the first thing they should do is to register themselves with our missions abroad, and not only to appear when they are in difficulties. Similarly, at this time, when the world is dealing with the Covid19, we are also asking our citizens, wherever they are, to comply with the rules and regulations that are put up in the countries where they are in the way of control and managing COVID-19. That is the situation in as far as what had happened in China. We take it as a result, and we believe what we are being informed by our missions, and we believe Namibians could also have faith and trust on our government and our representatives abroad.
Thank you very much, Deputy Prime Minister. I think we have heard the two discussions we're having today, speeches by the Minister of Health and that of the Deputy Prime Minister. I now give over the opportunity to the media practitioners seated here to ask their questions that they might have. I have a hand over there, ma'am. The floor is yours.
Good morning, Jemima Beatrice, Namibian Sun. So we know now for a fact that the government has let the people down by sending people...
Just a bit louder, Ms. Jemima. We cannot hear you properly.
Okay, so we know now for a fact that government has let the people down by sending people into high-risk people into self-isolation despite several warnings. So I think this obviously now we deserve as a nation to know, number one, what does this targeting testing entail? How will it work? Who will be targeted? Will the taxi drivers be targeted? Who will be the people that will be targeted? Also, Doctor, you have told this hall some time ago that the ministry is testing 30 people per day.
Is what?
30 people per day. You told us that the ministry, 30 people are being tested per day.
Oh.
And yet we stand, in the last 2.5 months, we've come only to a figure of 409. Why are we only at 409? And then we have the test, the JACMA donation. My understanding was that you are waiting for reagents or trying to source reagents. Have we now received these reagents? Are these machines now being used? We also have the rapid tests donated by the Chinese embassy. What is the issue with these machines? How will they be used?
And lastly?
And lastly, the 85 passengers that were stranded at the Hosea Kutako airport for more than 4 hours because the officials couldn't make up their mind, and then they were sent into isolation. Were they tested? Where are those people? Because some of us, I for one, I interviewed one of those people because after a few days, but he may be asymptomatic and so can I be now. And then the 26 passengers that were also taken to Walvis Bay. Were those people tested? Where are they? Are they now? What is the plan for those people? Thank you.
Thank you very much. Is there a question for DPM? Just so we alternate. Yes, Mr. Maima.
Honorable Netumba Ndaitwa, I understand that about 200 students are stranded in Cuba. And we also understand that the shelves are empty, even the toiletry where they can buy toiletries. So basically they are stranded. I also understand that the ambassador to Cuba is still in Namibia. I've seen him at State House on the 21st, so I'm not sure did he go back to Cuba. If he's still here, who's taking care of the students and the people, the Namibians in Cuba right now? Thank you.
Thank you very much. Perhaps we can start with the Honorable Minister of Health.
Thank you very much for your very relevant questions. I hope I got them all well, and if I misunderstood one, you are welcome to correct me. The first question, you alluded to the testing, and then you also said that you quoted me rightly that we are currently testing at about 30 per day. Yeah. As I made in my statement that COVID is a new disease, we did not have the capacity to do tests on COVID. It never existed. But when the world started experiencing COVID, we then built up local capacity. Initially, we could not test locally, but then we built up local capacity with NIP gradually. And we then put up criteria who can be tested. And mostly the initial criteria was focused on those who are suspected of having COVID-19. This was because by then the NIP did not have much capacity to do almost everybody who need to be tested. But gradually we build up that capacity. Now currently we are in a position to do 96 per run. We can have 1 run or 2 runs as long as there are specimens to be tested. The reason why we are not doing much currently is because of 2 things. Number one, the criteria we have put up, That's number one. And then number two, we have to preserve the little reagents we have. Because as you know now, the whole world is looking for this reagent to test their citizens. There is a scarcity of these reagents. That's number one. And also, as you know, that transport has been stopped. It's no longer easy to get things from outside to bring into Namibia. Either you have to charter a plane to go and collect where the commodities are to be found. So, but I must say that we have now revised our criteria. We are going to do as many tests as possible, but as I said, we will focus on the hotspots when we know that here we are likely to have transmission going on, because again the reagents which we have is not enough to apply to everybody. Yes, we had some reagents, test kit from Jack Ma. We have received that, and I believe you were also at the ceremony where it was received at the Ministry of Health and Social Services. Many of the journalists were there. They have witnessed the donation. But when it was looked further, there were some small components which were not together with the donation, and these ones were being sourced. And once they have been obtained, then those test kits will be used. They have already been validated. You also asked about rapid test. Yeah, let me maybe just explain at what stage you may need to use the rapid test. Now, you know that if a person contracts COVID-19, if a person contracts the virus, it will take between 2 and 14 days for the symptoms to appear. And the majority of them is between the 5th and the 10th day after contracting the virus. Now, the test which is being used is the test to detect the presence of the virus in somebody's body, the PCR in your body. Now, if you apply the rapid test or whatever test at a time when the conversion has not taken place, you are likely to get a false, a negative result. Whereas in actual fact, a person might have the virus. It's just that the time you took the specimen is not the correct time. Therefore, a rapid test, it has got its usefulness, but you must apply it at the right particular time. 85 people who arrived at Walvis Bay International Airport, and the 85 arrived at Hosea Kutako International Airport, and then the 35 arrived at Walvis Bay International Airport. They arrived on separate days, but these are the people who were not quarantined. They were not quarantined for several reasons, and they were allowed to go into the community. And these are the people whom we say they have lost to us because we do not know their status, because they were not quarantined like all others, to be followed up and to ensure that when they are released into the community, they have no signs and symptoms of coronavirus. For this now 120 people, we do not have that information, and this is a matter of concern. And also, why the lockdown has to be extended is to ensure that whatever will happen to these people, then we are able to a large extent to suppress maybe the transmission through the lockdown of the whole country. Thank you.
Honourable Minister, before you conclude, maybe just clarity on the last question around now this group of 120 people. So the assumption is that by extending the lockdown, sort of, we are giving the opportunity for those who might be symptomatic to show symptoms and be able to get to them should they start showing symptoms, is my understanding.
Yes, but there are also not only those ones, but there are also those who are contact of the confirmed cases and whose incubation period will last towards the end of April, maybe beginning of May, somewhere there. And those ones will also be brought into the net to ensure that they are not a source of infection to the other people in the community.
Thank you, Honourable Minister. Honourable DPM.
Thank you very much. As you might all know by now, that most, if not all countries, have closed their airspace. So, which means the movement of people has also stopped. That's why our ambassador to Cuba is here in Windhoek. He will not be able to travel back because there are no flights. However, I want to inform you that the mission is running. We have a charge. Every time when a head of mission is out of the station, the number 2 automatic takes over and be in charge of the mission. As for Namibians stranded in Cuba, to our knowledge, we know of 2 Namibians who are stranded in Cuba. And this is part of 93 Namibians who are all over the world, who have registered themselves with our missions abroad. But we are not in position to bring them back home because they are so scattered. You have 2 in Cuba, you have 1 in Thailand, you have 2 in Guinea. They are just all over. And when we put them together, we come to the number 93. And that's why we keep encouraging them to remain where they are until the airspace is opened. Because there is no way we can charter a plane to all these countries where they are for us to bring them back. We were fortunate that in the early time of closing airspace, there were some countries, particularly Europe, using Lufthansa, who had to come and pick up their citizens. And we used that window for some Namibians who were in Europe to come back home. And during that process, we managed to bring back 110 Namibians. And because the Europeans were to pick up their citizens, they brought our citizens and some of our essential materials, such as medical equipments, at no cost. And that really is something we appreciate. I have to say, during that time, over 2,063 foreigners will then be able to be repatriated back to their own countries. So that is really the situation, and we are not really aware of 200 Namibians stranded in Cuba want to come back home. We are aware of 2, and that is what we have in our records. And I really hope the nation will appreciate the dilemma in which we find ourselves to bring back these nationals when they are not at one place, but scattered all over the world. So we are just hoping that they will remain safe where they are. And then when situation improve, they will be able to come back home.
Thank you very much, CPM. Do we have any other questions? I have one over there and another over there. Yes, sir. Oh, yes.
Good morning. My name is Edward from Nampa. I just want to, my first question is directed to the Health Minister. Last week you were here and you briefed us on the status of the presidential aide whose spouse was tested positive for COVID-19. And you also told us that this presidential helper has been isolated. The person tested negative, but is in self-isolation. Later, we also learned that the president and his wife were tested, and they tested negative. We just want to find out if the presidential aide went into self-isolation because they tested negative. I just want to find out why the same did not happen with the first family. We just want to understand why the president and the first lady are not in self-isolation, as they were also equally exposed to COVID-19, just like their aide. Because the trend, what I see now is even the people that are currently quarantined, all of them tested negative, but they were still isolated. I just want to understand why the same did not happen when it came to the first family.
It's clear?
Yeah. The second one is on the mass testing that the ministry wants to roll out. How many people do you intend, the figure? Because you say as many as possible. What is this figure, this many as possible? What does it mean? And what is the cost? Because the understanding is also that one of the reasons why we can't test as many people is because it's expensive to do so. So what is the actual cost attached to this? Thank you.
Thank you very much. Yes, sir. Perhaps one more round of questions.
Good morning, Minister. Good morning, Honorable Deputy Minister, Deputy Prime Minister. I always get that wrong. Dr. Shangula, the issue of face masks are also becoming very much prominent now. We see across Africa many governments now making it mandatory, and we saw 1 million face masks arriving in Ethiopia for distribution across the continent. What is your stance and the government stance in that regard? Then last week the executive director of your ministry was saying that a special task force has been appointed to recruit Namibian foreign health workers and specialists from outside the country. Where are matters with that regard? And then
I didn't get that one.
The ED, Dr. Ngombe, was saying that a special task force has been appointed to recruit foreign health workers, Namibians who are in other countries, doctors and specialists to come and assist an already overburdened, I believe, health industry in Namibia. Where are matters in that regard? Honorable Deputy Prime Minister, yes, we are saying we cannot repatriate a lot of people from the different countries, but we have it on good authority that there are 42 Namibians in South Africa. Among them is a mother who went for a medical, we needed an operation on her back, but the operation couldn't be carried out because she had a hip infection. What is the possibility of assisting them, and what, while they are in South Africa? Because most of them had been there until the 27th. This lady in question was discharged on the 27th, exactly when we announced our lockdown and when Namibia stopped flights from wherever. So is there a way to assist them, specifically in a humanitarian case like this? Thank you so much.
Thank you. We'll get to responses. Is that fine?
Okay.
Honorable Minister.
Thank you very much. Yeah, let me respond to the questions of the first speaker. I just want to say that there is no connection between the presidential aid and the first couple. The president is on record as having said that the first lady traveled to Europe and then came back, and that was the reason why both of them were tested. And he also personally announced the result of the test. The presidential aid had an exposure with somebody on a very close contact who tested positive for COVID-19. And as a rule, anybody with an exposure will go into isolation and then to be monitored. Now, once a person is in isolation, is also receiving attention, and this particular individual was tested for COVID-19 and tested negative. So in that event, there is no need for continuation of isolation. So he is a free person just like you and me. On the question of mass testing, how many we would like to test, we are, as I stated, that we are going for a targeted. Number one, anybody who presented with respiratory ailments is a candidate for testing. We are also making use of community health workers for case detection to find out within the community who are likely people to be tested. Those ones will be tested. And again, we'll identify what I call hotspots, and those ones will also be target for testing. At the present moment, I do not have the exact figure that this is how many people we will find with respiratory ailments, how many people we will find who are in hotspots, how many people we will find who have been identified by the community health workers. But everybody who will be found will be undergoing tests. The cost is not now, because when we are doing our costs, it's actually free of charge. But that is a cost to the reagents, it's a cost to the personnel, it's a cost to running the machine, which at the present moment, currently, I cannot quantify that. Peter Denk, the use of masks. Yeah, it has been explained time and again that if one wears a mask, if a public member wears a mask, it does not mean that that mask is protecting the person who is wearing it. But that mask is protecting the people who are around that particular individual. That is the situation with wearing the mask. And I have in the past warned that people should not get that false sense of security, that if you are wearing a mask, then you are protected. It's not the case. But if you have a big number of people, everybody wearing a mask. So it means everybody is protecting everybody. So there is that ripple effect that everybody will then be protected because everybody has got the mask. But if only one person is wearing the mask, that person is only protecting the others against him or herself. So that is the position with wearing the mask. The last question on the doctors. Yes, we do have medical doctors who are in other countries, and most of them, they are in South Africa doing specializations. Now, during the lockdown, during the pandemic, many countries like South Africa, education have been suspended. Now, our people are there, they are not really doing what they went there to do, in other words, to study. That's why we say that instead of them simply being there and probably providing service to the host country, let us bring them back to Namibia so that they can provide the service to the Namibians. So in that respect, arrangements are being done for them to be repatriated to Namibia. And of course, as you know that flights have been suspended. We are looking into the possibility of going to airlift them from South Africa to come to Namibia to provide their services to the Namibian people.
Thank you very much, Dr. Deputy Prime Minister.
Thank you very much, Peter. You talked about 42 Namibians, and specifically you referred to a family. Our ministry, through our mission in Pretoria, has been in contact with the South African Authority to clear 42 Namibians who have opted to come by road. And we have been dealing with that case. We have received a letter dated 12 September in which 42 names are listed, and this is it reads, to whom it might concern. This serves to confirm that the following Namibian nationals have been cleared to travel through the following borders on the 13th to 14th April. Immediately I got this communication. I also shared it with the Minister of Health for them to arrange the appropriate reception, particularly when it comes to them to be quarantined. So if that family you are talking about is among the 42, they got their clearance, unless it's not among the 42. But that is the situation in as far as the 42 Namibians who have been in South Africa and conducted our mission wants to be authorized to drive back to Namibia.
Honorable DPM, just to confirm the date of the letter, is it 12 April?
Yes, it's
12.
written 12 April 2020.
Yeah, for travel for them cleared for 13 to 14 April.
Yes.
All right.
Yeah.
Thank you very much, DPM. Last question, sir.
Good morning, Thierry, freelance journalist. It's not really a question, but I'm just looking for clarity from Dr. Shangula. I had a quick visit yesterday to Katutura Hospital. I see there's a makeshift screening center outside the hospital. I wanted to know whether this has been done, this is the same with all the other state hospitals, and whether this is just confined to Windhoek or also on the outskirts.
Okay. Doctor, is the question
I don't
clear?
think I have got the question.
Just
the
repeat it.
voice was a bit...
Okay, I'm saying yesterday when I made a quick visit to Katutura Hospital, I realized
Katutura?
Katutura Hospital. I realized that there's a pre-screening makeshift center outside the hospital, set up in a tent where all those people that are visiting the hospital go through first for screening. I wanted to know whether this initiative has been done with all government clinics and also all referral hospitals, or whether it's only just confined to Windhoek or also countrywide.
Exactly, Doctor. He says he visited the Katutura State Hospital yesterday, and there's a makeshift tent outside the hospital which screens all individuals entering the hospital. So he would like to know, is this an initiative only at Katutura State Hospital, or is this done across the country at all referral hospitals? Thank you very much. So perhaps in answering that question, Doctor, you could also squeeze in your final remarks, and then we hand over to DPM to do the same.
Okay. Hospitals have got their own management, and we said that each hospital must put a measure in place to be able to manage, especially the queues, the long queues which are normally happening at health facilities, to manage the queues and also to ensure that there is appropriate social distancing. It is so that the Katutura Hospital took that initiative to implement those measures. It is expected that all other hospitals, they do the same. But different hospitals have got their own arrangement, which may be slightly different from what's done in Katutura, but which fits that particular environment. Now, in conclusion, I would like to say that I was extremely pleasant that the Namibians, despite the hardship they are experiencing during the lockdown in terms of movement, they have accepted the extension of the lockdown. Even before that, I have received many messages from Namibian citizens suggesting that the period of the lockdown may not be sufficient and that it may be extended to the rest of the country. So that is a pleasant moment that these measures, despite the hardship, they have been accepted by the Namibians. And I also feel that in that spirit of acceptance, then there will be the compliance to the measures which are put in place. And with that, we can be confident that we will be in a position, we will be able to overcome the COVID pandemic. Let me also conclude by saying that let us stay at home, let us observe personal and individual hygiene, wash your hands, and stay at home. Thank you.
Thank you very much, Doctor. Honorable.
Thank you very much. I just want again to emphasize the point that we really ask Namibians, whenever you are outside the country, conduct our nearest mission abroad. They are there for you, and it's very, very important that we know who are our nationals in a specific country. 2, during this difficult time of the coronavirus, we are once again appealing to our nationals that wherever you find yourself, please protect yourself. Comply with the national regulations which are put there to avoid the spread of the virus. It will be on your own interest, it's in the interest of the country where you are, as well as the Namibian nation at large. I would also at this stage would like to thank individuals, groups, and organizations who are providing support and assistance during this difficult time, particularly the support which is to take care of the social well-being of our people, those who have lost the income, particularly those who are benefiting from the informal trading, that now we are making efforts to give them some food. The unemployed and those, the homeless. We really appreciate that support, and we continue to appeal to the nation to play their part. And to the beneficiary, we ask you to make use of that support to the best of your families. Let it benefit you, to sustain you during this difficult time. Again, we are all aware of the government emergency grant is targeting a specific group, and we are asking us really to be in solidarity with one another and to be sincere and honest and to allow the targeted group to apply and for the targeted group to benefit. Don't unnecessarily overload the system to the extent that you make it difficult for those in need to be assisted. This is the time solidarity in its real term is required to enable us to go through this difficult time. And those of you who are going to assist, those who might not have cell phones, again, is honesty that is required. We must support one another. If we work as a team and support our president, who has really taken this very seriously, will definitely overcome. Thank you very much.
Thank you very much, Deputy Prime Minister. I think that clarion call is very clear to all of us Namibians that we can only achieve what we'd like to achieve during this difficult time by ensuring that we get to 0 cases that are active in Namibia around COVID-19, by staying apart but working together to ensure that all of us keep being safe and healthy during this time. That is all we had today as we discussed the extension of the lockdown and the alleged mistreatment and enforced testing in China around those topics. And we thank you, viewers, for constantly listening and paying attention to the messages being given here. Join us again this afternoon at 4 o'clock as we look into the modalities of testing by the Namibia Institute of Pathology through the Ministry of Health and Social Services in trying to curb the transmission and spread of COVID-19 in the country. But be rest assured that we continue to delve deeper into the discussion around how the new lockdown extension will affect all Namibians by calling together stakeholders during this coming week of education, safety and security, as well as finance, to clarify the issues around the measures that are still in place to ensure that all of us emerge out of this healthy, safe and victorious. Thank you all, viewers, for staying with us, and we hope that you continue bringing your questions and queries through the different channels that have been put in place. That is all from us here at the COVID-19 Communications Centre. Have a nice day.